Okay, guys, so we finished the first computer, and that is your spinal cord. Now it's time to learn about the second computer, and that is your brain. So if the spinal cord has spinal nerves, what do you think the brain has? What kind of nerves? The spinal cord has spinal nerves, and the brain has what kind of nerves? Cranial nerves. These are the brain nerves. We don't call them brain nerves, we call them cranial nerves. So we have to get the directionality correct. So rostral means facing the nose, towards the nose. Caudal means toward the tail or the spinal cord. So the major portions of our brain are your forebrain. Okay, we can see our forebrain and the cerebellum, and that is the second largest region. And then you have your brain stem. Who do we say the brain stem is made up of? The brain stem is made up of the midbrain, the pons, and the medulla oblongata. Okay, so we said rostral is towards the forehead, while caudal is towards the spinal cord. Okay, we have the forebrain, the cerebellum, and the brain stem. So the cerebrum is the largest part of the forebrain, which constitutes about 83% of the brain volume. And we have cerebral hemispheres. These are the pairs of the half globes of the cerebrum. So you have this, you say, some people are right-brained, some people are left-brained, and that is because you have this middle shallow groove between, the right and left hemisphere. What's a gyri? Not gyro, gyri. This gyri is thick fold on the cerebrum surface. So there are longitudinal cerebral fissures. So the longitudinal cerebral fissure is a deep groove that separates the cerebral hemispheres. There is a corpus callosum, and this corpus callosum is a thick bundle at the bottom of the longitudinal fissure that connects both hemispheres. This corpus callosum is a thick nerve bundle at the bottom of the longitudinal fissure that connects both hemispheres. So your both hemispheres are separated by the longitudinal fissure, while the corpus callosum is nerve bundles at the bottom of the longitudinal fissure that connect both hemispheres. So the cerebellum is the second largest part of the brain. It is located in the posterior cranial fossa. It is separated from the cerebrum by transverse cerebral fissure, and they also contain fissures known as sulci and gyri. Sulci and gyri. The brain stem is representing the rest of the brain. They include the midbrain, the pons, and the medulla oblongata. So the cerebral hemispheres, these cerebral hemispheres, you see they're separated by the longitudinal cerebral fissure. That's your temporal lobe attached to what bone? Earlier we said the temporal lobe is attached to the temporal bone. The parietal lobe is attached to the parietal bone. The frontal lobe is attached to the frontal bone. And the occipital lobe is attached to the occipital bone. What is this fibrous tissue here? That is this nerve bundle. That is known as your corpus callosum. This cauliflower structure, that is known as the cerebellum, the second largest region in the brain. While the midbrain, the pons, and the medulla oblongata, both of those, they represent what? They represent the brain stem. They represent the brain stem. So what is the choroid plexus? The choroid plexus is where we filter the blood and we make cerebrospinal fluid. This cerebrospinal fluid is made and manufactured in the choroid plexus. It is made from the plasma of the blood. So we filter the blood, and from our own blood plasma, we add and modify the concentration of solutes within our cerebrospinal fluid to make this cerebrospinal fluid in the choroid plexus. So the brain is composed the same way the spinal cord has gray matter and white matter. The brain also has gray matter and white matter. So the gray matter contains nerve cell bodies, dendrites, and synapses. And you have the cortex. The cortex is the surface layer of the gray matter in the cerebrum and the cerebellum. Even in the kidney, we have the kidney cortex. So when you hear cortex, that's the surface, that's the outer layer. And nuclei, these are the deeper masses of the gray matter surrounded by white matter. White matter is composed of tracts. These are bundles of nerve fibers known as axons. These are deep to the cortical gray matter in the brain, and they connect one part of the brain to another and to the spinal cord. So the nervous system develops from the ectoderm, which is the outermost tissue layer of the embryo. So neurulation is very important step within your embryological development. So we create a hollow neural tube by day 26. So then we have the formation of the embryonic neural tube. Okay, so the nervous system development, when we look at the nervous system, there is a neural crest. This neural crest is a longitudinal column on each side of the neural tube formed from the ectodermal cells. And by the 4th week of development, the neural tube exhibits 3 primary vesicles. There's the forebrain known as the prosencephalon. The prosencephalon is your forebrain. And you have your midbrain. Your midbrain is the mesencephalon. The midbrain is the mesencephalon. And there is the hindbrain. The hindbrain is the rhomboencephalon. The hindbrain is the rhomboencephalon. So the nervous system development continued. So we have the forebrain eventually dividing into vesicles known as the telencephalon and the diencephalon, while the midbrain would remain undivided and retains the name mesencephalon, while the hindbrain divides into two vesicles known as the metencephalon and the myelencephalon. So this is your rhomboencephalon, which is made up of metencephalon and myelencephalon, and you have the mesencephalon, and that is the middle layer, and you have your prosencephalon, and that is your made up of the telencephalon, the optic vesicle, and the diencephalon. The meninges are very important. We talked about those in your spinal cord. So we say that the nervous system has to be protected by three different layers. You have an outer dura mater. That's the really strong layer outside, like a helmet, protecting your spinal cord and your brain. Between the dura mater and between the vertebral column, that is where they make the spinal injection. And in the middle, between the dura mater, as you're approaching your central nervous system, the middle layer is known as the arachnoid mater, And then deeper to all of that, we have the pia or the pia mater, the softest layer. So the cranial dura mater is composed of two layers. You have your outer periosteal layer that is equivalent to the periosteum of the cranial bones. There is the inner meningeal layer that continues into vertebral canal and forms the dural sheath around the spinal cord. The dural sinuses are spaces located where the periosteal and meningeal layers separate. So they collect the blood circulating through the brain, and there is a superior sagittal sinus just under the calvaria along the median line, and there is a transverse sinus that runs horizontally from the rear of the head towards each ear. The dura mater presses closely against the cranial bones, and there is no epidural space. And there are folds of the dura mater. You have your falx cerebri, and these separate the two cerebral hemispheres. Then there's the tentorium cerebelli, which separate the cerebrum from the cerebellum. And finally, there's the falx cerebelli that separate the right and the left halves of the cerebellum. There's the arachnoid mater. The arachnoid mater is a transparent membrane over the brain surface. And you have your pia mater, that is the most delicate and the most thin layer that is intimate with your spinal cord. So these are the meninges of your brain. You have the skull, that's your dura mater, and that is your arachnoid mater. So the dura mater, you have the skull, then you have your dura mater made up of periosteal layer, then a meningeal layer, and finally you have an arachnoid mater. This arachnoid mater right below it is your pia or pia mater. Meningitis. Meningitis is the inflammation of the meninges. It could be due to an infection, a microbial infection. In the microbial infection, what happens is you would have leakage. You would have leakage of some viral infectious organism that would enter through the nose into the sinuses. You know, in the respiratory system, we have nasal sinuses for air. And we also have in the brain dural sinuses. That is where your spinal cord fluid is located. The pia mater and the arachnoid mater are most often affected, and they can cause swelling of the brain, enlargement of the vesicles, and hemorrhage. Signs include high fever, stiff neck, drowsiness, and intense headache. They are diagnosed by examining the cerebrospinal fluid obtained by lumbar puncture, known as a spinal cap. The ventricles are four internal fluid-filled chambers of the brain. There are two lateral ventricles, one in each cerebral hemisphere. So you have two lateral ventricles, and from the two lateral ventricles, you would have an outlet into the third ventricle. That is known as the interventricular foramen. And from the third ventricle into the fourth ventricle, you have an inlet known as the cerebral aqueduct. And the central canal is the tube that connects the fourth ventricles and runs through the center of the canal. These ventricles, they are fluid-filled chambers of the brain. So look at them here. So the two ventricles, these are your two ventricles. Right below them is your third ventricle because there's two of them. 1, 2. The second one is not going to be number 2. It's going to be number 3. So the two ventricles, 1, 2. Below them is ventricle number 3. And all are connected with this inlet known as the interventricular foramen. And from the third ventricle into the fourth ventricle, this inlet, this passage path is known as the cerebral aqueduct. And then from the fourth ventricle down into the spinal cord, you have the central canal. So these here, what are these? These are your two ventricles. This is the lateral ventricle. These are your two lateral ventricles. And in the middle is your third ventricle. Right below it is your fourth ventricle. So now the cerebrospinal fluid is a clear, colorless liquid that fills the ventricles and fills the canals of the central nervous system and bathe its external surface. So the production of the cerebrospinal fluid begins with the filtration of the blood plasma through the capillaries of the brain. And then you have your choroid plexus. The choroid plexus is a spongy mass of blood capillaries on the floor of each ventricle. There are ependymal cells. These ependymal cells represent neuroglia. This neuroglia line the ventricles and cover the choroid plexus. So ependymal cells modify the filtrate. And compared to the plasma, you see we make cerebrospinal fluid from the plasma, but it is not identical when we examine the cerebrospinal fluid and the plasma to each other. The cerebrospinal fluid has more sodium and more chloride, and it has less potassium, less calcium, less glucose, and very little protein. So the cerebrospinal fluid continuously flows through the central nervous system. It is driven by its pressure, beating of the ependymal cilia, and pulsations of the brain produced by each heartbeat. So the path through the ventricles, we talked about that. We have lateral ventricles, and through the intervertebral foramina, you have this intervertebral foramina. This intervertebral foramina is going to allow for the cerebrospinal fluid to come down from the two lateral ventricles into this intervertebral foramina. Is going to allow cerebrospinal fluid that is secreted in the lateral ventricles to come into the third ventricle. And from the third ventricle, we squeeze all of our cerebrospinal fluid into the fourth ventricle through the cerebral aqueduct. So through the cerebral aqueduct. So the third and the fourth ventricles add more cerebrospinal fluid along the way. So all the cerebrospinal fluid ultimately escapes through three pores that lead into the subarachnoid space of the brain and the spinal cord surface. So there's a median aperture and two lateral apertures. So the cerebrospinal fluid is reabsorbed by the arachnoid granulations. There is a cauliflower-shaped extensions on the arachnoid meninx. They protrude through the dura mater into the superior sagittal sinus, and the cerebrospinal fluid penetrates the walls of the microvilli and mix with the blood in the sinus. So you have cerebrospinal fluid is secreted by the choroid plexus, you see, in each lateral ventricle. These are my two lateral ventricles. Then the cerebrospinal fluid flows through the interventricular foramina into the third ventricle. Then the choroid plexus, you'd have the choroid plexus in the third ventricle would add more cerebrospinal fluid. And number four, the cerebrospinal fluid would flow down the cerebral aqueduct to the fourth ventricle. And the choroid plexus in the fourth ventricle would add even more cerebrospinal fluid, and the cerebrospinal fluid out of the two lateral apertures, and this median aperture would flow through the canal, through the central canal, would fill the subarachnoid space and bathe the external surface of the brain. The arachnoid granulations, cerebrospinal fluid is reabsorbed into the venous blood of the dural sinuses. So now we learned what cerebrospinal fluid is. Now we have to see the job. So first we learned about the anatomy, the structure of cerebrospinal fluid. Now we got to learn about the function of cerebrospinal fluid. Why do we have cerebrospinal fluid? The first reason is we have the cerebrospinal fluid for buoyancy. So it allows the brain to attain considerable size without being impaired by its own weight. If the brain rested heavily on the floor of the cranium, the pressure would kill the nervous tissue. The cerebrospinal fluid is also important for protection. So it protects the brain from striking the cranium when the head is jolted. So shaken child syndrome and concussions still occur from severe jolting. Chemical stability represents when the flow of the cerebrospinal fluid rinses away all the metabolic waste from the nervous tissue and homeostatically regulates the chemical environment. So blood supply to the brain. So the brain only contributes 2% of adult body weight, but receives 15% of the blood. Neurons have high demand for ATP, therefore oxygen and glucose. So constant blood supply to the brain is critical. We see that 10-second interruption of blood to the brain causes loss of consciousness, and 1 to 2 minute interruption causes significant impairment of the neural function, and 4 minute interruption causes irreversible brain damage. So the brain barrier system regulates what happens, regulate what substances get from the bloodstream into the tissue fluid. That's why cancer chemotherapy, there's a challenge. There's a challenge of treating, you're closing your ears. You're done with this class. Is it that cold? You guys want me to turn on the AC? I mean the heater? You don't need the heater? You want me to call the guy? Okay, let me call the guy. Okay, we're gonna get the heater. Just a little bit. So he's coming. Okay, so the blood-brain barrier system regulates what substances can get from the bloodstream into the tissue fluid of the brain. And although the blood is crucial, it can also contain harmful agents. So the brain barrier system is selectively permeable. It is highly permeable to water, glucose, and lipid soluble substances such as the oxygen, carbon dioxide, alcohol, caffeine, nicotine, and anesthetics. 2 points of entry must be guarded. The blood capillaries throughout the brain tissue guarded by the blood-brain barrier. Capillaries of the choroid plexus. These are guarded by the blood cerebrospinal fluid barrier. So the blood-brain barrier protects the brain at the blood capillaries. Consists of tight junctions between endothelial cells that form the capillary walls. So there's a blood cerebrospinal fluid barrier that protects the brain at the choroid plexus. It is formed by tight junctions between the ependymal cells. Tight junctions are absent from the ependymal cells elsewhere. So a stroke, also known as cerebral vascular accident, is sudden death of brain tissue due to interruption of blood supply. That can occur at any age, but 2/3 are over 65 years old. Thank you so much. So the second greatest cause of death after the coronary artery disease. So what's a stroke? A stroke is irreversible. So when you say death, that is irreversible injury. That cannot be under any circumstance restored. Okay, so when it comes to stroke, what happens? What happens is you have blood supply, where blood is going to nourish and perfuse brain tissue. Let's say this is the brain with all the nuclei. These are all nuclei. So 100% of the blood is going to arrive to nourish 100% of the brain. In a stroke, due to a plaque or a clot or an occlusion, we're going to have less blood arriving to the brain. So we used to have 100% blood arriving. Now we only have 70% of the brain tissue getting nourished and perfused. The 30% is going to die. So what are the reasons? You can have ischemic stroke. That's ischemic stroke. When you have ischemia, loss of blood supply to the brain tissue, ischemia. And you have this tissue dead. So that is dead tissue. That is about 30% damage. And the rest 70% is fine. So that is caused by ischemia. That tissue died. There is sometimes hemorrhagic stroke. That is ischemic stroke. Hemorrhagic stroke, there's no occlusion. The blood is moving fine. But the patient always has high blood pressure. And the high blood pressure is hitting the walls. Is hitting the walls of your blood vessel. So that's gonna make a balloon like that. So the blood is gonna go inside the balloon and it's gonna roll here and it's gonna clot inside, then it's gonna rupture and blood is gonna leak out and you're gonna have a hemorrhage. Loss of blood, internal hemorrhage, loss of blood. Your blood is spilling inside and cannot arrive to that place. Okay? Any questions? So the medulla oblongata is part of your brainstem. It is the adult brain region that develops from embryonic myelencephalon. It begins at the foramen magnum of the skull and extends about 3 centimeters rostrally and ends at a groove just below the pons. It is slightly wider than the spinal cord. The pyramids, these are ridges on the anterior surface that resemble side-by-side baseball bats. The olives, these are prominent bulges lateral to each pyramid. And the graciles and the cuneate fasciculi of the spinal cord, they continue as 2 pairs of ridges on the posterior medulla. So they contain sensory fibers. They contain sensory fibers that synapse in the gracile and the cuneate nuclei. This is the thalamus. This is the infundibulum. And that is your medulla oblongata. So that's the cross section of the brainstem. We said the brainstem is made up of the midbrain, the pons, and the medulla. The pons the adult brain region that develops from the metencephalon. And the pons have cerebellar peduncles. These are thick stalks on the posterior pons that connected and the midbrain to the cerebellum. There are cranial nerves, number 5, number 6, number 7, and number 8. And there's a reticular formation in the pons that contains additional nuclei concerned with sleep, respiration, and posture. The medial aspect of the brain. You have the pons. These are the pons. And this is the medulla. That's the medulla oblongata. And that is your midbrain. That is the midbrain. Which of the midbrain regions is highly implicated in Parkinson's disease? That's the substantia nigra. It is a nucleus within the peduncle where with dark nucleus that is pigmented with melanin, and there are the motor center that relays inhibitory signals to the thalamus and basal nuclei, surpassing unwanted body movement. There's degeneration of the neurons that leads to tremors known as Parkinson's disease. The red nucleus, why they call it the red nucleus, is actually pink in color, but is due to the high density of the blood vessels. It is within the cerebral peduncle in the tegmentum. The tegmentum is where you have your red nucleus, and it has connections to and from the cerebellum for motor control. So the tegmentum is where you have your red nucleus. The substantia nigra is where you have Parkinson's disease. And the cerebral crus is the bundle of nerve fibers that connect the cerebrum to the pons, and they carry the corticospinal tract. These are cross sections of the brainstem, known as the midbrain. Okay, reticular formation. Reticular formation is a loose web of gray matter that runs vertically through all levels of the brainstem and into the upper spinal cord. Remember when we said the spinal reticular tract? It ends here, and this is the reticular formation, a loose web of gray matter that runs vertically through all levels of the brainstem and into the upper spinal cord. So that's the reticular formation and functions of the reticular formation nuclei. Number 1, it's important for somatic motor control, where they adjust the muscle tension to maintain the tone, the balance, and the posture, especially during the body movement. There's a cardiovascular control. The cardiovascular control is important for cardiac and is regulated by cardiac and vasomotor centers within the medulla oblongata. Functions of the reticular formation nuclei. You have pain modulation. The reticular formation is important for pain modulation. It's important for sleep and consciousness, and it's important for habituation. The cerebellum. Cerebellum is the largest part of your hindbrain. It is the second largest part of the brain as a whole and contains more than half of all the brain neurons. It's made up of the Purkinje cells and granule cells. And what's the name? So you know the cerebellum is split in half. The same way your cerebrum is cut in half with this lateral fissure, so is your cauliflower-shaped cerebellum. What's the name of the fissure that slices in half your hemispheres, your right and left hemisphere? What's the name of that fissure? Longitudinal fissure. Excellent. What's the name of the fissure that slices, cut in half your cerebellum? That is between your left and right cerebral hemispheres. And in the middle, you have the right and left cerebellar hemispheres. These are connected by a bridge known as the vermis. Known as the vermis. Cerebellar peduncle. These are three pairs of stalks that connect the brainstem and the cerebellum. Their fibers carry signals to and from the cerebellum. Is sensory, linguistic, emotional, and other non-motor functions, including comparing textures of objects, perceiving space, and planning, scheduling, and emotion control. The forebrain. The forebrain consists of two parts. You have the diencephalon, which encloses the third ventricle, that is most rostral part of the brainstem, and there's the telencephalon that develops chiefly into the cerebrum. The telencephalon and the diencephalon are the forebrain. Midbrain is the mesencephalon, and the hindbrain is your metencephalon, the pons, and the cerebellum, and myelencephalon is the medulla oblongata, and then you have your spinal cord. The diencephalon has three major components: the thalamus, the hypothalamus, and the epithalamus. The thalamus is an ovoid mass on each side of the brain, and there's the diencephalon is where you have your thalamus, and then another part of your diencephalon is the hypothalamus, and it forms part of the walls and the floor of the third ventricle. We talked about the cerebrum and the frontal, parietal, occipital lobe. These are our lobes: the frontal lobe, the insula, and this is our precentral gyrus, and that is the postcentral gyrus. And right in the middle is your central sulcus. On the back is your occipital lobe, and it's for visual awareness, while the temporal lobe is for hearing, smell, emotion, and the parietal lobe is for taste, visual processing, spatial perception, language, numerical awareness. Frontal lobe is for motivation, for mood, for abstract thought, and insula is for taste, the pain, visceral sensation, and consciousness. Okay, we can stop here.